You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. According to my first guest, we're discussing dental implants. Who's a candidate? With us, we have an expert on the topic, Dr. Birdi. Dr. Birdi, welcome to the program.
Thank you so much, Randy. How you doing?
Now, great. Now, for people that don't know you or know your practice, who's your typical patient? I mean, what are the different procedures you do?
Well, right now we have really everyone that's under the sun that comes into our office. We have anything from a person that's missing 1 or 2 teeth or wants something cosmetic to someone who doesn't have any teeth and has been a long-standing denture wearer, and we're able to provide all services under one roof. So it's a multi-specialty, multi-doctor practice. It's just brand new built. It's only a few months old now, the new center, and it's state of the art. So we've got everything from multiple specialists to imaging and everything under one roof. So we can provide all types of services at a specialist level, all under one roof.
Okay, now the periodontists, they're the ones that, like the gum specialists, right?
Yeah, they're the gum specialists, the guys that do tissue surgery, place dental implants, work on patients that have periodontal disease. That's kind of the full scope of what they do.
And then the prosthodontics is what? That's the people that make the teeth.
Absolutely, they're the ones that are the I would say the quarterbacks, or the ones that actually set up the cases, and they end up putting the teeth on top of implants or on top of teeth, and they direct kind of what the case is going to be like.
Okay, good. Now, at the top of the show, we said no more dentures. Is that the future of dentistry? As we know them, traditional dentures are out?
I would say that traditional dentures, I think little by little, we're going to start having 2 implants being basically the bottom line that we can have, or the minimum amount of treatment. The World Health Organization actually stated that.
So like 2 implants to snap on a denture?
Yes.
Okay.
Absolutely. So that's kind of what we think is going to be the standard of care at the bare minimum. But there's always going to be people that wear dentures, and I think that's going to be always something that's out there. But we're trying our very best in our practice to educate people and provide services so that, the quality of life of everyone, especially a denture wearer, increases and is better.
Is it a big problem? I mean, there are a lot of people where you are that have dentures? Upper or lower dentures?
I think there's a lot of people everywhere that have dentures. You'd be surprised. The reason why you don't know about them is they don't come to the dentist all that often. They're not here all the time. They're not coming for the regular checks or regular cleanings all the time. They're going to see maybe a denturist. But I bet you it'd be easy to fill a stadium full of people that had needed dentures.
So within an hour of your practice, tens of thousands of people have either an upper or lower denture?
Yeah, absolutely.
Okay. Now you say with just 2 implants, they can get something that's no more adhesive and things like that.
Absolutely.
In the same day.
In the same day. With 2 implants, you can get a denture that snaps onto those implants. It's like the push buttons on a kid's shirt, and it really helps you, make things comfortable. It's still going to be a denture. We're able to provide other services like teeth in one day. We're able to provide a fixed set of teeth in one day as well. And really, it just changes someone's life. It really does.
And we've talked on the telephone. You say people can walk in without teeth and walk out with a fixed set of teeth. I mean, a full arch of teeth.
Yep. Absolutely.
That happens?
That happens. We did it last week. So
how old can you be?
You can be anything from young to old.
Like what are the age ranges?
I would say I've done procedures like this on someone as young as 27, 28, and we're doing something on a patient that's in their 90s at the end of this month.
Interesting.
Yeah.
Now, why would a 90-year-old want to do this?
Because they've waited a long time to be able to do it. A lot of times they just want to be able to get that quality of life, be able to chew and eat. And for them, it's, for them, they feel like, well, I want that quality of life now. What am I waiting for? And
they can't eat and chew.
Absolutely. Absolutely. A lot of people on the day of the treatment, when they walk out with teeth, they can chew things they can never chew before. Sometimes a juicy steak, sometimes apples, sometimes corn on the cob. It just depends on what they're wanting to eat. But the difference is huge.
If it's as good as you say it is, why aren't all these denture wearers lined up to do it?
Well, there's lots of reasons for that. Sometimes the denture wearers have got to where they are because they've been missing many teeth. They've gone through multiple procedures, whether it be root canals or extractions or fillings or broken teeth, and they've been through heck and back. So they want their teeth out, and they're afraid to go to the dentist because they don't want to go back there anymore. And there's that. There's also the fact that
it does seem painful.
You know what? All my patients, the majority of them, I would say, that when they go through something like teeth in one day or having overdentures in one day, it's little to no pain for them. The reason being is because it increases the stability of their dentures. They're not pushing and rocking and causing sores and everything, and it really helps. The other thing too is denture wearers a lot of times are just not informed. They don't know other options. It's rare that they come in knowing, I know all these options. I can get crown and bridge on implants. I can do all these things. It's so rare that happens. Most of the times they come in, we show them photos and options. They're blown away. They have no idea that all of this is possible, and they don't have to do it for a year or 2 years. It can be done in one day a lot of times. Okay,
now, we invited you on the show.
Yep.
And in fact, one of the largest manufacturers of dental implants said you're the guy to interview about dental implants. And we should say, and I'm not siding with you, I mean, people need to know it's a real interview, but you lecture, I guess, all over the country teaching other dentists about the surgical components and the restorative parts of dental implants.
Yeah,
Is that right?
Absolutely. I've been lecturing all over North America and the world, for about dental implant therapy, whether it be the surgical or prosthetic portions of it, not just for one company, for multiple
What
ones.
are you teaching them?
I'm teaching them how to treatment plan these cases, how to plan them out to make sure they can do them right, how to deal with complications, how to provide these services for their patients so they can do them, really well in their office. And that's kind of different. We want to be able to make sure we give people knowledge. Knowledge is power. We want dentists to be able to provide this for the patients in their office.
Now here in the U.S., there's like 3 people involved sometimes, where you have to, one person is a surgeon, then the other person that puts on the teeth is another doctor, and then maybe an imaging somewhere else. Is that the way it is in Canada?
It is that way exactly in Canada. Most places you go to see first the surgeon or either a general dentist or a prosthodontist to go and get the treatment plan done. It gets sent to the surgical person to kind of do the surgery, and then maybe an imaging center is involved, a lab's involved. It's multiple places, multiple consults, multiple appointments, and then the whole scheduling can be real tough. In our office, we have everything under one roof. So what ends up happening is, and we don't have it at just any level, we have it at a specialist level. So we have multiple specialists in the office, multiple surgical specialists, prosthetic specialists. We've got our own cone beam CT scan machine. It's got the lowest radiation right now that I know of in the world.
You told me in the green room, you said, we have the best CT scanner in the world. And I laughed.
Well, it's true. Like right now, we have one where...
Like it's low radiation.
The radiation is the least amount in the world right now. And we're the first ones in Canada to get it. And the radiation is as little as you would get every day just walking around town using your cell phone. It's less than actually one normal dental radiograph a lot of times. Okay. It's amazing.
All right. Now, you say you're changing people's lives.
Yeah.
How so?
Well, let me show you somebody. Look at this lady.
Okay.
Look at her. That's someone that I treated actually when I was in residency, and she was the denture wearer, came in, she was just going through things in her life, and she wanted to get something changed. And so she's like a lot of denture wearers that I see that come into my office. They've got a set of teeth that are all looking the same color, that she's not happy with. She's had them for years. They're worn down. She wants to be able to chew better, eat better, and just have a better smile.
Okay.
And we can do that for her. We can provide her with something that looks better, and she's able to chew better and feel more confident about her everyday life. And a lot of times we can do that in one day.
Now, when they come in, like a woman like this, what are their questions? Like, what do they want to know every time? What is that consult?
They want to know, how long is it going to take? Is it going to hurt? How long will it last? And how much is it going to cost? Those are the 4 numbers.
How long can it last?
I tell a lot of my patients, to be quite honest with you, if an implant goes in stable, the restoration is done well, and it's maintained well in an office that knows kind of how to maintain it. Aside from some prosthetic adjustments or changes throughout the years, those implants will outlast them a lot of times.
Is that right? Okay,
absolutely.
Good. So this woman, she comes in, she's wearing a denture she doesn't like, and you have an after on this.
I do. If you look at her now, that's
wow.
That's what she looks like.
They look like porcelain veneers.
Well, no, those are denture teeth.
Is that right?
Those are denture teeth. Yeah, it's a fixed hybrid on the bottom and a denture up top, and lots of implants, and she's really happy. You can tell just by the photo, and and I remember treating her, and it's like this for a lot of different patients, where they come in and they look one way, and then the day they're going to get their teeth, because they've gone through all, whether it be a try-in or something to try it in on the way, they come in with their hair done, they come in with new makeup, they come in, it's life-altering. It's such a big difference because of how confident you feel every day, how good you're going to feel about yourself.
So how much say do they have in what their teeth are going to look like?
They have a lot of...
I mean, do you show them like samples?
We show them samples, we show them photos, we encourage them to bring in photos of themselves that they liked. Also, we do a try-in. We're never going to just put teeth in without their approval. We're always going to make sure that they're involved in the treatment, they have a say, they're able to discuss the color, the shape, the shade, the position of the teeth. And then when that's all proved, then we go to the final. That's how we go about it.
Okay. And if somebody's watching this and they're a denture wearer, what if they've been in for 20 or 30 years? Not enough bone?
Well, you know what? That's a question I get all the time.
Because my mother, that's what they told my mother.
Sure. I get that question every week. I've been with denture wear for 30 years, 40 years. A lot of times in Canada, in some of the rural areas, they used to pull your teeth at 18. That was just something that they did. So that's such a traumatic thing to go through your entire life. But it's rare that anyone can never get implants. I personally have never been able to not treat someone because they didn't have enough bone. There's always somewhere to get bone. We can always grow bone.
Has that changed in the last 5 years?
I would say that it's changed in the sense that our technology is better. We can evaluate cases better. We're much more predictable in our results. And on top of that, I think our treatment modalities or how we go about these treatments has become more predictable. Well, before it used to be, okay, you go see somebody, they treatment plan you go see somebody else, then they get treatment plan, then you get your surgery. A lot of times you go without teeth, and you're waiting 6 months, and then someone takes an impression, and then you get your finals, and it's a whole year, 2-year process. We do it in a day.
But tell me this, why is it what used to take 6 months or 9 months now can happen in a visit or 2 visits?
Well,
I mean, why is it so much faster now?
This is where we have to give credit to a lot of people that have, kind of conducted the research and really made this something that's predictable, okay? And this is not something that's new. It's been around since the early 90s. It originated in Europe, and we started to do more and more of this treatment throughout the world. Now,
So it's just philosophy?
Philosophy?
Like they were more cautious?
Not so much. They were able to push the envelope in a very cautious way to be able to make sure that we can do this predictably, find out how we're going to do this well, and to decide, okay, well, this is what we do in the upper arch versus the lower arch, or this is what we do for this type of patient versus this type of patient. And that allows us to now just really deliver great results and really predictable results. Now, someone comes in, they get teeth in a day. They get fixed teeth that day.
Interesting. So if you're missing 1 tooth or 3 teeth, or
Yeah,
your whole mouth's a disaster?
Absolutely. We can provide this type of services as long as the patient's health and other things are ideal. I wouldn't say ideal, but we can work with those things. We can do it for a single tooth. We can do it for multiple teeth.
What if you have bad gums? Somebody says,
sure.
I have bad gums.
I would say that being a periodontist, we try our very best to get those gums to be better before we start treatment. Do bad gums relate to bad gums around implants? They can. Absolutely they can. But we maintain implants like we do with teeth. You come in for your visits every 3 to 4 months. You end up coming for your cleanings. We maintain everything in terms of the way you're biting and the way tissues are.
Okay.
A lot of times we're doing things to regenerate and fix that tissue before we start. So it's just a matter of deciding what we've got to do. But just because you've got bad gums doesn't mean you can't get implants.
Now you use laser, right?
Yeah.
Because I said we got to have you come on the program to talk about. You have a laser that kills this bacterial infection.
Exactly. We've got actually 4 different lasers in the office right now. We've got a lot of them, but we do laser therapy around implants and around teeth to battle periodontal disease and some of the pathogens and problems that are around them. We also use lasers to do treatment minimally invasive. Our office is built that way. We do a lot of treatment under a microscope. We try to do things with either a pinhole or a very small incision. We're using our CT scan to do things that are computer guided so that we can do something so minimally invasive that a surgery that would normally take you 4 or 5 hours, you can do in an hour and not have to leave, you don't leave with a suture or a stitch at all, which is pretty amazing.
Interesting. Okay, so you brought more photos.
Absolutely. So look at another guy here. He's somebody that, started off, came in, said, "Doc, I need teeth. I want teeth."
So what's going on with him?
Well, he's like a lot of patients that I see in my office. They come in with their hand over their mouth, or you ask them to smile, they don't show their teeth, or it's one of those smiles they've perfected at home in front of the mirror.
What does that mean?
Well, it means that they go home and they smile in front of the mirror. A lot of denture wearers do this. A lot of people that aren't happy with their teeth do this, is they're sitting in front of the mirror and they'll decide how much of a smile it's going to be when they smile.
Just to show the tips of their teeth.
Exactly, just to show enough so that people don't see everything, because they're worried that if I smile too big, laugh too hard, I'm going to show things I don't want to see. And people don't want to see, and they're worried about it. So that was what he was like, and you look at him in his final. Like I'll show you his final photo. It's absolutely changing. It's life altering. That's not a smile that we had to push him to do. That's a smile where he's smiling as happy as he possibly can. It's one of those things where he's just as happy as he possibly can be, and he's vibrant. It's a whole different thing for him. And it's funny that my wife and I talk about this all the time, and I love doing this type of treatment because it is life-altering. It is one of those things where I enjoy providing this kind of service, because you don't get this if you just do surgery. When you do the prosthetics as well, you're able to provide a service for somebody, and it changes their life that day. We have people crying in our office all the time. We had a patient on Friday, this is past Friday, that we did upper and lower teeth in one day on. He has got some medical issues and some other things going on, but he couldn't wear teeth for 12 to 15 years. He had no teeth.
Wow. Just
because of the intricacies, and I can't go too much into it, but in the sense that he just couldn't wear teeth. He couldn't wear dentures. It was not able to be done. And we were able to provide him with implants for his teeth in one day.
Like a full arch of teeth?
Yeah.
Is that right? How soon can they eat?
That day. They screw him in, we screw him in. A lot of times, there's a classic video where we'll give him an apple to bite. But a lot of times what we do is we take it easy, you go home, eat something a bit softer initially, but overall you can eat Softer doesn't mean bread and water. Softer means a taco, soft sandwich, a lot of things that you can normally eat. And then eventually it's going to be a steak. It's going to be really anything they want.
But are these common? I mean, you see things like this a lot?
A lot. He's not any different than a lot of people's relatives, uncles, aunts, people that we see every day.
Do they ever say, I wish I would have done this years ago?
Well, yeah, that's not what they say. It's what they always say. It's what they
Really?
say every time. Is that I can't believe I waited this long. I wish I'd done this 10 years ago. I wish I'd done this 8 years ago. Especially the denture wearers. Those are the ones where when they go from dentures to fixed teeth, it's like night and day. It's for them. It's such a big difference. I don't think, and like you and I don't understand it. Even though we don't understand it. When they have dentures, they're worried about, okay, when I talk or I laugh too hard, are they going to move? Are they going to dislodge? Are they going to fall out? If I get food underneath it, and that my patients talk about all the time, I get food underneath it, and I start to keep chewing, and it hurts. Well, I can't finish that meal, so they excuse themselves, and they go to the bathroom. And one of my patients totally said this to me. It's amazing. He said, not only is it that tough, but when he gets to the bathroom, he waits till everyone leaves. He waits till everyone in the area and in the men's bathroom until they all leave, so he can get in front of the sink, take his denture out, rinse it out, and put it back in his mouth. That's life altering.
Look, I know a few denture wearers. They never complain to me, right? Well, I'm not a dentist though.
Exactly.
But is there such thing as a happy denture wearer, or have they just adapted?
I think there are happy denture wearers out there because there's happy people. I think there are happy people in general, but. And I think everyone adapts to whatever they can adapt to. That's why people can wear dentures.
But if there was a try-in period,
oh gosh,
it's not possible. They couldn't go back.
If we could give them an implant to try out or 2 implants,
like a weekend with some teeth,
they would never go back. Basically, as soon as we put it in for the first 5 or 10 seconds, they would right away. They'd be like, okay, let me go chew with this, and then they'd be like, how do I get the money to do this? Well, if I don't have it now, what can I do? How long can I wait? What do I have to do so I can get this done now? And honestly, it happens to us every week. Every week, people come in just from the photos. They make the decision.
Now, insurance doesn't usually cover dental implants. Doesn't here in the U.S. either.
Sure.
You have finance plans. You work with them.
We work with a couple companies that do that as well. We work with a few banks as well that we do that with as well. In general, I would say that insurance companies, they're getting better though. I have to admit that they're getting better with their covering some things, but the vast majority. They're not covering for implants. Sometimes they'll cover the denture. Sometimes they won't.
I think you told me this. You say everybody says it's like the best money they ever spent.
You know what?
Or something like that.
Very much so. And the reason being is because it changes their life. As much as it sounds like a cliche thing to say, it sounds like, oh, whatever, give me a break. It's the confidence thing. It's the fact that they can face the world now without feeling like they're different or they're worried every day. And that's a big deal. I couldn't imagine every day worrying about, okay, if I bite into this sandwich or I bite into this meal or I laugh too hard, I'm worried. To get rid of that and then to feel strong and confident again, you can't put a dollar figure on that.
What's the hardest thing, because it sounds good, right?
Mm-hmm.
I mean, I don't, but what's the hardest thing for you to get denture wearers to believe? That it's as easy as it could be, or that they're not too old, or it doesn't hurt? I mean, what are they the most skeptical about?
A lot of times, they're skeptical about how fast it can be done, if they have enough bone or not, and how are they going to clean it? Those are the 3 main questions that they always ask about. Okay, now for fixed teeth, they come in, and that's the difference than dentures, right? They're going to have to clean them like they would with teeth. They've got to brush them, they can floss them, they can use a water pick. Water pick's great. We use them for a lot of our patients. Really helps with people that don't want to floss a lot. But the other part is we can also do something like teeth in a day and have it be removable. Have something that comes in and out of your mouth, so you can still have that great function, that great stability, and something that won't come out of their mouth unless they actually want it to, and then allows them to clean a bit.
So this isn't just lip service to say teeth in a day. I mean,
No.
You guys, like you said, you're equipped to handle it.
Yeah, absolutely. We do it every week. So it's a matter of someone coming in, we assess them, say, okay, here's your date. Let's take some impressions, take our records. They come in, and we get it all done that day.
Do they ever get emotional? I mean, they look at themselves in the mirror.
They get emotional every time.
Do you ever hear food eating stories?
I hear food eating stories. I get the phone call sometime on the weekend or a text message saying, "Doctor, look what I can eat now."
Do they ever say, "Are you sure I could eat this?"
Yes, that happens a lot.
That seems like I'd be afraid of it.
Yeah, and it's amazing. Everything is going to be with care. Everything is going to be patient-based, depending on each case and everything, of course. But a lot of times they can eat a lot of things. It's pretty amazing.
So we have time for a few more photos.
Sure. So here's this lady. She was just starting to wanted to get into retirement, like a lot of people, and they want to make sure their teeth are taken care of and things are going well. And in doing so, she said, she came in and she said, like, oh, I want whatever needs to be done so I can be set for the rest of my time. And she actually was the first teeth in one day case that I did.
Those teeth had to go.
They had to go. It's a lot of times people come in and they have teeth that are either almost gone or they're at the last end, let's put it that way. Mm-hmm. And we've got to remove them, and we do that.
So it hurts when they chew?
Sometimes, a lot of times you'd be surprised.
They're just
loose, and they bleed, and they're very careful about how they chew and how they bite.
Okay.
They know they're dealing with something that's a little bit compromised, and they've got to do something about it.
Do you get on these consults? Because I mean, you're pretty passionate about this, right? I mean, do you ever get excited because you see the future? You say, "Well, this is going to be good."
I hold back excitement all the time. The reason being, especially if it's a case where I can gauge the patient, I know what I'll be able to provide pretty predictably, and I know what it's going to do for them. Those are the ones where I get eager. I'm like, let's do this. Come on, let's get together. Let's get this done so that I just want you. I want this to happen for you. And that's the biggest thing. So absolutely. So someone like this who.
So what did you do for her?
So I worked with another doctor in this office on this case, but it ended up being where we ended up removing her upper teeth first, and then giving her teeth in a day. That same type of treatment, and then on her lower teeth as well. Her very first teeth in one day case, upper and lower, and you look at her at the end. Look at her smile at the end. That's not like the smile from before. Before she trained herself how to smile. Look at it now.
That's a beautiful. And those are dentures?
Those are denture teeth.
Okay.
Those are denture teeth. Those are teeth in one day. They're denture teeth. They're something like, as you can see in the model here, like this, right? Where they're fixed teeth all in one day.
So this is what it is?
Yeah.
Okay, so they just kind of.
It's a little horseshoe, and,
okay.
and there's nothing on your palate, no big flanges of acrylic or anything in one place. It's just teeth, and just in one day.
So for these patients
that
are highly anxious,
sure,
what do you do for them?
We offer sedation in our office. So we offer different levels of sedation in our office, from oral to IV, depending on the case. And like I said, all under one center. We can do everything for you. And in that situation, we're able to provide services for our patients where, if they are anxious and they want to, go to bed for it or go to sleep for it, it's great. We can do that for them.
So they don't feel it during the procedure.
Mm-hmm.
But after the procedure, you say it's not really a painful situation?
It's not that bad. You'd be surprised. A lot of patients will come in saying, listen, this was easy. I can't even tell that anything happened. This is amazing. They tell their friends. That's a lot of times. I've had a couple times where, the settings we use they make them a bit forgetful. So I've had a couple times where patients have called and said, okay, I've got all these teeth. They're beautiful. They're a little bit emotional on the phone and said, how did I get them?
Is that right?
How did I get them? Or we had one person who thought they forgot their appointment because we did something. But in general, it just depends on the case. But
and you could use their own denture if you have to.
Absolutely. A lot of times, if they're happy with the way it looks, or if I think that it's structurally pretty good, we can use that existing denture because it'll allow us to kind of expedite things a little bit for them.
But you want to make a cosmetic look. I mean, these seem to be like cosmetic dentures.
Absolutely. We want to make sure things look good. We're not going to put something in just because it's it's okay. We want to make sure that something is good.
You gave me a speech about that in my green room about okay isn't good enough for you or something like that.
It's one of those things where there's a lot of people providing services in the world. A lot of dentists providing lots of different services in the world. And people are doing really good work. There's no doubt about it. The biggest difference between dentists is really truly what they think is acceptable. What they think is good at the end. What they feel is this is what I think is good in my office. And that could be drastically different than someone across the street. And there's no really way for a patient to gauge that so much. Do you know what I mean? Sometimes there is, but in general, when you're lecturing and you're talking on the podium and you're discussing things with your fellow dentists, well, you want to provide your best work, but you also want to make sure that your standards are high. And you want to make sure that when you do provide work that, you want to make sure things are good. The director of my program once told me that when I was a young resident, he said, if you can't take a photo of it and show it to your colleague or to me, you're not done. It's not good enough.
Okay.
Right? So you want to be able to take a photo of whatever you're doing and show it to somebody else and say, okay, well, this is how I feel good about this.
Now, you lecture all around the world.
Yeah.
Okay. Teaching people about dental implants. Does it cost more to go to a specialist because you are prosthodontist and a periodontist?
Yeah. So
isn't it true? Like one of the few in the world. I mean, there's not a lot.
There aren't a lot of dual specialists in perio and prost or prosthodontics and periodontics very often. In Canada, there's only a few of us. I think there's only maybe 2 or 3 at maximum. In the States,
Some people might call them super specialists.
well, I wouldn't go that far. I would just say that
That's what they call them out here.
Well, I would say that
I've met one, I think.
we go through a lot of education, and we're happy to provide services for our patients. But I think it just depends on the cases.
So
But
high standards. You think that that's your competitive edge? I know you
I
don't
think
want
so.
to brag about yourself.
No, but I
you
think
said.
I definitely want to make sure that I provide the best that I can. Absolutely, every time.
Okay, good.
So, well, one thing I do want to say is that in Canada, the dental implants is not a recognized specialty. Okay, so there are only certain certified specialties in the country, and I'm lucky that I'm certified in 2 of them.
So you're not a specialist in dental implants.
Well, there's no such thing as a specialist in dental implants.
but you focus your practice on dental implants.
It's what we do most of.
Okay,
yeah.
I'm glad you mentioned that. Time for absolutely one more.
Okay, so here we go. This is a case where a patient was a denture wearer. She came in and she had some teeth remaining in certain areas, and she came in actually with her daughter, and a lot of people come in with their family members. A lot of times it's their family members that push them to come in. Men are really bad at that. They wait to the very end, and then it's normally the wife that tells them to get in, or somebody, the sister that says no, you better go in, and they'll confirm the appointments even. It's amazing, but. She came in and she knew she had to get something done, and she knew that her daughter was going to get married and all those kinds of things. So we wanted to make sure that we did something well. And we provided her with services where she'd be able to get teeth, she'd be able to get implants on those teeth, with those teeth. And we gave her a new set of dentures with some implants, and it worked out really, really well. She's very, very happy.
Let's see the after.
Here's the after.
Very nice.
It was amazing. When we gave her those teeth, she was so happy with the way things looked, the smile of things. Like anything, there's always a few adjustments here and there, but in general, very happy. She ended up being one of the cases that I used for some of the certifications that I did. So we got one more.
Okay.
Here's a patient where he was someone who came in who had a lot of problems, a lot of issues, wasn't happy with the smile, wasn't happy with things. And it was a tougher case that I did, and it worked out really, really well. And we knew that he just wanted to have whiter teeth. He wanted to feel better about himself and be able to chew what he wanted to chew. So in the end, we were able to do something like this for a final. And
Looks very happy, by the way.
He's a happy guy. He's really happy with what he received. He's happy with his smiles. But more than anything else, he's happy with the fact that he can feel confident smiling, talking, eating, and facing the world. And that's what it's all about.
Good for you. Final message, we're out of time. Somebody watching this, maybe they're missing a few teeth, they're a denture wearer.
Sure.
But maybe they're still skeptical.
Sure.
They're afraid.
Sure.
What do you say to them?
I would say that the best thing is to come and get your options. We offer a complimentary implant consult in our office. Even our CT scans a lot of times are free for those patients. And it's a no-risk consultation. Come on in just to get your options, just to know what you can and cannot have done.
I want to thank you for coming on the show. Very good, really good. You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.